Obviously, walking is second nature to most of us, but if you're starting to dread putting one foot in front of the other, you might be suffering from osteoarthritis or neuropathy. Both can cause extreme pain, and there's the added fear of falling. At NexGenEsis Healthcare, Dr. Reddy and Dr. Fuhrman are helping people to get back on their feet without pain medication that just cover up the symptoms or surgery that can cause other issues. They shared how they use regenerative treatments and get to the root of the problem. Gentlemen, as you know, we are living longer today, but that comes with some other things, including joint pain, osteoarthritis. It's something that we've oftentimes associated with a much older population, but you're starting to see more and more people younger with osteoarthritis?
Yeah, so typically, osteoarthritis is seen in the elderly population, but we are seeing younger and younger patients that do have it. Osteoarthritis is really, it's just that breakdown of that joint space, usually due to just normal wear and tear, but can be due to other, injuries as well that can kind of speed up the process there.
I can't imagine one of your patients that we had met a while back, she had issues with osteoarthritis in her 30s. So can you imagine what you're feeling like in your 60s if it's not addressed properly? All right, you all address joint pain, but one of the most common ones obviously is the knee pain because we put a lot of weight on that, but you address joint pain throughout.
Yeah, so we can address joint pain throughout the entire body, really any joint in the body, peripheral joints like you mentioned, the knees, the hips, the shoulders, and the joints of the spine, so the low back and the neck as well.
What causes it? Is it mostly just the wear and tear?
It's usually caused by just that wear and tear, yes. And really, when you get that breakdown of that joint space, you lose mobility, you get pain from that bone-on-bone friction, and, it really affects quality of life.
Yeah, and people are oftentimes given the options of maybe some shots that to kind of pad things, if you will, but it'll also lead to, well, that's it, we got to go in for surgery. Here you have options that you don't have to go that far.
Yeah, so we offer a combination of advanced modalities as well as using the patient's own biologics to kind of help to restore some of that mobility that they've lost and really improve their quality of life.
Yeah, all right. The other thing that a lot of people are dealing with, neuropathy. And it's one of those things that's kind of tricky, I think, in the beginning because people think, okay, I slept on my arm wrong, or, my foot's numb because whatever, I may have injured it or whatever. But really, at what point should somebody say, I probably should go in and get this checked and see if it truly is neuropathy?
Sure, yeah. So if it starts becoming more constant, right, maybe not just when you're waking up, maybe during the middle of the day, you just feel it randomly, the numbness, the tingling, the burning, hands and feet, most commonly that's where that's going to occur. And if you just start noticing it more constantly, like I said, or the severity is getting worse, maybe it starts getting painful, burning pain, then that's definitely when you need to get it checked. This
is not only hazardous, it can be dangerous.
Absolutely. It can definitely be dangerous because it can get worse over time. And if it gets to that point, unfortunately, there's only so much that can be done.
Yeah, you saw that with your grandmother.
I did, yeah. She definitely had severe neuropathy, being diabetic, diabetes, most common cause of neuropathy. Unfortunately, she had to have an amputation, and that affected the rest of her life.
Yeah, we use that word neuropathy, but what does it really mean that's happening in the body?
Yeah, so essentially it's just general nerve damage, right? The nervous system is not functioning properly. Whether that's due to lack of blood flow because of diabetes or trauma, surgeries, chemotherapy, and that's kind of where we come in and get everything working properly again.
Yeah, okay, well, human nature for a lot of us is just give me something to make the symptoms go away. Just because you may have made the symptoms go away doesn't mean the problem goes away. It keeps marching on. And a lot of those things people take for symptoms only are short-lived.
Exactly, yeah, so common things, gabapentin, Lyrica, Neurontin, those kind of medications are given to these patients to downplay the symptoms, right? It can help them kind of get out of this pain, but that pain will come back because of the progression of the neuropathy.
Speak to some of the other treatments that you offer that really some of them can be done in conjunction with each other. Sometimes you might need just one thing to take care of an issue.
Right, yeah, everybody's different, right? So, we do an examination, kind of determine the level of damage that is going on, how severe the neuropathy is, and then we provide a treatment plan for that patient specifically, whether that's with different therapies like acoustic compression, laser and light treatments, nerve plates, and vibration plates, even like Dr. Reddy mentioned, the patient's own biologics, something called PRP or platelet-rich plasma to spark that healing process and get those nerves to rejuvenate and regenerate.
Yeah, and Jeffrey is testimony to the difference that these treatments can make. Let's listen.
I came to NexGen a year ago because I seen advertisements. Had a nephew pass away earlier with neuropathy, taking gabapentin. I had burning in my toes, my feet were numb, I was unstable walking. I went through their process, their treatments, and within 3 months, the burning was gone. Within 6 months, the numbness was gone. I didn't want a Band-Aid. I want it fixed. I have feeling back in my feet. I am stable walking. I went to the right place to get my neuropathy fixed.
All right, Jeffrey says came to the right place. After 3 months, the burning was gone. After 6 months, the numbness was gone. Didn't want a Band-Aid, he wanted a fix, and that's what you all want to do. Fix the problem, not just cover up the symptoms.
That's exactly right. There's lots of treatments out there, but us using the regenerative medicine, we're looking to address the cause of the problem and not just cover the symptoms.
Yeah. What does it make you feel like to see people come in this door feeling defeated? Because a lot of times they've been everywhere. And then to walk out these doors and do something as simple as walk to their car again.
It's extremely rewarding for us to see that when patients come in and they're having all these troubles with their day-to-day activities, and by the time we finish with them, they're basically ready to run a marathon.
Yeah, right. Well, thank you very much, gentlemen, for restoring people's quality of life.
Yeah, thanks for having us.
Yeah, of course.
The first 50 callers to mention Great Day Houston will get a complimentary phone consultation to see if you're a good candidate to come in for an exam. The number to call, 832-570-4529. Again, that number is 832-570-4529. To learn more, visit NexGenEsis Healthcare.